Mental health professionals, rather than just police, are now responding to some emergency calls with the launch of a new state-funded program. The aim is to try to prevent a mental health crisis from turning into a potentially deadly encounter with police, prioritizing treatment over a criminal justice response when possible. The nonprofit provider Trilogy Behavioral Healthcare, based in Rogers Park, launched its mental health emergency responder program earlier this month. And joining us now to share how it's going so far are Samantha Handley, president and CEO of Trilogy Behavioral Healthcare, based in Rogers Park, and Christopher Mayer, clinical director of crisis services at Trilogy. Thanks to you both for joining us. Samantha Mayer, let's start with you, please. Tell us how this program works exactly.
Well, Trilogy's first response alternative crisis team, or FACT team, provides support to individuals in crisis when and where support is needed. FACT provides immediate mobile response to people experiencing a mental health crisis by sending out mental health professionals to help keep people safe and get them linked to the services that they need.
And Christopher, how do you coordinate the response from Trilogy? How do you coordinate that with police officers?
Yeah, absolutely. So, as part of the state program as implemented, the normal response is for mental health first responders to go out solo to calls where there isn't any indication of significant physical safety risk. So, when we receive a call to our crisis line, a staff answers that call and coordinates a response of one of the response teams. And so, if there is an indication that police accompaniment would be necessary, then we also coordinate with police partners to respond in person with them.
And you said when you get a call to your crisis line, where does that call come from? Does that call come from 911 dispatch?
Not as of yet. So, currently, we operate our own crisis line, and calls come from either individuals themselves in the community or different partners, healthcare organizations, nonprofits, ward offices, sort of all different types of stakeholders. Eventually, calls will get dispatched from a new mental health hotline that people can access by dialing 988. And that number is rolling out nationally, but in Illinois, that will be connected to a network of providers just like us all throughout the state.
Okay, and Samantha Handley, Chicago's Department of Public Health, it also launched a similar program last fall. Will responses between your program, the one with the state, and the cities, will those be coordinated at some point?
I'm not sure about that. I know that right now we are primarily dealing with the north side. So we are primarily covering Rogers Park, Edgewater, West Ridge, Uptown, and then the suburbs of Skokie and Evanston. But we are always in meetings with other providers. We are all learning how to do this together, sharing resources, and building a system that will work best for everyone that lives in the Chicago and Illinois community.
And Samantha, this rolled out, we know, earlier this month. How is it working so far?
Well, I think it's working really well. Chris is actually the best person to ask because he's the one that's actually been seeing some people that have been calling the number.
Yeah, Christopher?
It's been going great. We have been getting calls. People have been made aware of the line. So we're happy that our community engagement efforts have been reaching people to increase access to this service. So things have been running smoothly, and the meetings that have happened so far have been going well.
And Samantha, what would be needed? Because as you said, you're working in the north side right now and several suburbs immediately next door to Chicago. What would eventually be needed to scale this up into other communities?
Well, really what we need right now is just more people. I mean, we've hired about 9 or 10 clinicians right now. We're hiring counselors and social workers and peer support people. These are individuals with lived mental health experience that can provide support to people as well. And so that's what we've been focusing on. And as we continue to ramp up our program, we'll be able to offer it eventually 24/7, 365 days a year. And I think, you really just need the manpower to be able to do this service by qualified mental health professionals.
And of course, Samantha, we've heard a lot of talk about the increased need for mental health care over the course of this pandemic. Have you experienced an increase in demand for the services you provide?
Absolutely. Across the board in all of our services, whether it's our community-based outreach services, our child and adolescent therapy services, our adult therapy services, just across the board, the demand is so high. People understand the level the level of social isolation that people went through during COVID really increased people's mental health symptoms, in addition to, losing jobs, food insecurity, income insecurity. All of those things combined with the social isolation has really created a perfect storm for people to experience mental health symptoms.
And of course, in some cases, losing a loved one
Yes.
to the illness itself. Christopher, in 2019, the police department alone responded to more than 41,000 calls involving a mental health issue. The fire department responded to another 27,000 calls. Given the scale of this need, is a program like this just the beginning?
Absolutely, it's just the beginning. We're really going to see the system expand and all levels of the system become really more robust, both the actual public responses as well as nonprofits throughout the state. So in just the first year of this program, there was $70 million that was invested in community mental health centers throughout the state to scale and increase access to these services.
Okay, and briefly before we let you go, Christopher, give us a sense of what happens on the ground if, when there is a call where both a mental health provider and police officers need to respond.
Yeah, absolutely. So we often coordinate responses with police when we're concerned that there is a significant physical safety risk. So one example would be earlier this week, we received a call, with information that there might be weapons in the home in addition to someone experiencing active psychosis. And so in that type of situation, we're not going to respond solo. We coordinated with the crisis intervention officers of the 24th District, which is the Rogers Park Police District, to respond with us to try to provide support to that individual. Okay. So that's typically what it looks like when we're coordinating.
Important work for you both. Samantha Handley and Christopher Mayer, thanks so much for joining us.
Thank you.
Thank you.